in our body, depending on the genetic profile that we have. Just like we do blood group, everybody doesn't have the same blood group. Some have A, B, O, all that we have, they're positive, negative. Like that, genetic testing is to the next level, where we give you the whole panel of your body's genes. We also know that people with certain genes respond to certain diets, to certain exercises, to certain medicines. So that is what this counseling is all about. After getting the genetic report, we will match it. You're not touching anything.
No, nutrition is doing
saliva. We spit on the floor, on the road. No, then nothing happens to human being. No? When we spit on the road. So like that, instead of spitting it out, we're taking little and then testing. No, what will happen? Only saliva.
I'm talking mutations.
We are not changing any mutation.
No, general question actually.
No. Yeah, so that is called gene editing.
Yeah, gene editing.
It's called gene editing. Okay. Where leukemias and many other diseases, by changing a gene, you can actually cure the disease. But that's in a very early stage, because there you are interfering with the gene.
Yeah, I'm a general question.
You can become a Frankenstein monster, or you can become something. Here we are not doing anything. We're just taking your own saliva and looking like taking blood. We don't even have to poke. Just with saliva you're able to.
Thank you.
Any other questions?
Whatever you need to know about yourself. So if in the general population you want to know what is the best food for you, what is the best time to exercise, which is your circadian rhythm, when is the best time to sleep, there are people who sleep very late at night, and there are people who don't sleep so well at night. So there are multiple things going on, right? And if you are someone who's interested in knowing how best to, or Dr. Hina said that very well. Someone can eat a mountain of rice and not gain any weight. Someone can eat one katori of rice and still gain weight. Okay, so there's so much of difference in the ability of the body to absorb, digest, and have an output in terms of energy or whatever. So every person is different. No two people. Sir asked whether in the same family, no fingerprint is the same. No genetic code is the same. Every individual born is unique. So what we are saying here is, use your own genetic code to find out what's best for you. What will work for you. People exercise all the time, but not everybody loses weight. Some people lose tremendous amount of weight. Some people will not lose any weight. Some people gain weight. Some people nothing happens, right? So each one is determined by what your genes are upregulated. So that is useful for anybody, whether you're a child, whether you're an adult, it doesn't matter. You can unravel these things quite easily.
If you go one step further, everybody knows about the weight reduction injections. Everybody is talking about these miracle drugs and all that they're called. If you give the same injection to two brothers, I've had a classmate of mine and his brother, they were taking it. One person loses 20 kilos, the same injection, same dose. Another person doesn't even lose 10 kilos. And then they are asking, why I am not losing, my brother is losing, his gene is different, your gene is different. Okay? There are some who don't lose even half a kilo after taking the maximum dose of these agents. Small percentage, 5%, 10%. But then it's not worth wasting time. If we knew genetics in advance, we wouldn't have given it to that person. Now after 6 months, 1 year, after spending so much money, they're realizing they're not responding. So that is where I think genomics will come in handy to find out not just medicine, but also diet. We're going to apply it for medicines also. Today, we have, as I said, we've got 12 types of medicines. All the 12 are not suitable for everyone. For some it will be metformin. For some it will be sulfonylurea. For some it will be DPP4. For some it will be SGLT2. For some it will be GLP1. Different people are there. Now we are guessing, maybe this man will respond. Instead of that, we can do a genetic test and then decide. It is already being used. I can tell you, see, there's a drug called clopidogrel. You would have heard of that. Blood thinner. Some people don't respond to clopidogrel at all. And earlier we used to give clopidogrel to everybody. After 6 months, when he gets heart attack, it didn't work. So today, this genetic test is being used by all cardiologists. When they write clopidogrel, do genetic pronoun. This is not clopidogrel. Give him aspirin, not clopidogrel. But somebody else say no, not aspirin, clopidogrel. So it is becoming part of routine treatment.
Sir, so how is GLC different from regular lifestyle changes by diabetes or diabetes individuals? How is GLC going to be different than the regular one?
So as already said, a typical diet charts or lifestyle counseling gives you do's and don'ts. We generally talk about do not eat this, and eat this. We don't quantify it many a times. We start saying you eat one chapati or whatever by calorie control or whatever. This GLC diet will give you more personalization. End of the day, we are looking at personalized nutrition, personalized health. So GLC diet will tell me when, how much, what, and how. All these questions in an absolutely personalized form. Are you suitable to intermittent fasting, or you need regular intervals of food? How does alcohol behave with me? How does sweets behave with me? So this regular diet counseling may not have the answers to all of this, which a GLC counseling diet chart can definitely give you the solutions for this.
Hello.
Yes, sir.
My
Go ahead.
my name is Shivkumar Bellan. I'm a medical science storyteller. Doctors always fascinate to listen to you about the new technologies. My question is that in the Indian market, when it comes to nutraceuticals, that's one area, it's a gray area where, especially when you say diabetes, you have type 1, type 2, you are very clear in that. But what nutraceutical to choose? And I've seen many patients, their B2 levels are so high, and even without knowing that they were also on B complex vitamins. It's already high and they're taking. So by doing this GLC genes thing, so you mean to say they'll have a targeted, tailor-made nutrition for patients which can really help them, especially could be magnesium or zinc, which helps a role in diabetes like that. So that's what I want to know, your insights on that. So it will be a very targeted approach in these type of patients, sir, the nutrition one?
100%, I think Dr. Geeta and Dr. Anjana.
Yes, this is where it is more important, especially the GLC part of it, and nutrient-based nutrition. We can do blood tests of B12 or maybe for that matter your hemogram, but we really cannot do most of the B complex biot, pyridoxine or
8 to 10 drugs, because you'll be meeting a diabetologist, a cardiologist, and so on and so forth. When there is so much of an array of drugs which the patient is taking, and in the busy practice, you might really not know what are the drug-drug interaction and drug-to-food interaction on the absorption level is thing. So my question is that, one, by doing this, can we give him an optimum level of dosing and choosing of the drugs, number one? And how artificial intelligence can play a key role on, even when you, in the prescription when you give him, it can be scanned and found out whether this drug is interacting with the other drug, and so that many things can be avoided at a very initial stage of the other thing. So I want your insights on that.
Thank you for that very nice question. Already we are practicing it to some extent. For example, today we have algorithms already built in, even without genomics. Because with genomics I showed you how the child went off insulin and got controlled with tablet. But even without that, today we have our own AI built systems within our electronic records. So when we put in the age, body mass index, weight, height, and all other parameters, HbA1c, lipids, automatically the AI based system is telling us these two drugs are probably best for this patient. This one is probably better avoided. Of course, we still have the choice, okay, this is what the computer is telling me. No, but I think I'll still use it for this particular reason. Or I'll say, yeah, thank you for reminding me. For example, in the electronic records, we just say pregnant, and by mistake you order X-ray, it will tell you, watch out, this lady is pregnant. Don't order. We may forget, taking, we'll put up X-ray also. The lady will be pregnant, and that can damage the fetus. But the electronic record already warns you. If you already said she's pregnant, it will tell you, don't do an X-ray. So like that, science is developing. We are able to already practice it to some extent. Genomics also we do, Dr. Radha and her team, whenever needed we do that. But we have not applied it so far for routine treatment of type 2 diabetes, routine treatment of type 1 diabetes, for people who want to lose weight. Those kind of things we are not applied to. GLC takes it to the next level, where we are trying to apply it.
If there's, there are many questions
Yeah,
coming here.
please.
So especially there's Mr. Abhishek Poddar or Dr. Abhishek Poddar has put a list of them, so I'll just summarize it.
Yeah.
What inspired Dr. Mohan and team and Dr. Mohan's to launch this preventive and precision healthcare initiative, and how different is it from the other clinics, diabetes clinics in India?
Well, we've always been at the forefront of cutting technology. And 20 years ago itself, we introduced, 25 years ago, I think Dr. Radha set up the genomics center at our center, and nobody had ever thought about it. When we started introducing personalized treatment, precision diabetes, in the same hall, we inaugurated 5-6 years ago Precision Diabetes Center. That time only the word precision diabetes had come to the world. Nobody in India had even thought about it. That time we inaugurated a center here. Actually, the Honorable Health Minister inaugurated that center here. So we've always been ahead of it. So it's not new for us to say what is the next mountain we have to climb, or what is the next technology which we have to introduce. Now, the earlier, you may say, why you didn't do it 5 years earlier? It was far too expensive, it was far too complicated, the technology wasn't there, it would take months to get a reading. Today we are able to get it from saliva, we are not able to get it. Today non-invasively we are able to do that, and therefore at that stage we introduce into the routine clinic. So today the time has come that people are trying their best with diet, weight reduction, lifestyle, nothing is working for many people. So we have come to the conclusion that using a more scientific approach, we'll be able to solve it, and that's the reason why today we have introduced it. We studied it for a long time, then we said now the time has come to, and for everything the time has to come, because the right technology has to mature, and at the right time for the right patient. Now is the right time for the right patient.
Dr. Anjana could add to that, and also the question to her is on what's the long-term vision behind this initiative for preventive healthcare?
I think this is just the beginning, and we have started today with lifestyle, food and exercise. Someone was asking a question about drugs, that is next, that we are doing. Sir, there are AI/ML algorithms being developed by our scientific team, particularly our data management teams, which are going to integrate all of these things together, your food, your drugs, the interactions between all of these, such that at a very, like if you just give saliva, I'll be able to tell you your whole, whatever will work for you, which drug will work for you, what will harm you, what will help you, all of this is going to come. So this is just the beginning. There are multiple things that are coming in the pipeline. Over the next few months, we expect another announcement, and a few months after that. So it's not very far off. It's all within our reach. Within the next couple of years, you'll see huge changes coming.
And is there any success rate so far, and how do people plan to approach it?
So success depends on what the individual is looking for. As of now, I think we have about 11 patients who have given GLC, and there are some 5 others who we did as pilot, and I can only tell you they have been extremely happy with what they have done. It has helped them, from their own words, helped them change their life for the better. So I think that would be, as more and more people find success in whatever they are looking for, I think that's going to define the success of this entire program.
Another one is on, after this counseling, GLC, will there be only advice for diet, nutrition, exercise, or can some diabetes treatment be given?
So this will work for diabetes also. So our what you eat determines how your blood glucose behaves. So if you eat the right kinds of food, you can avoid the glucose spikes, and thus your glucose will come under control. So yes, very much for diabetes treatment. Also, it will be very helpful.
We already have continuous glucose monitoring, which everybody is using now, and using that we'll be able to see, giving one diet, how the spike, the glucose control goes with the CGM that we wear, and with another diet, how it occurs. So everything can be very scientifically documented.
So this GLC is affordable for everyone, sir.
Well, we are trying to make it affordable. So we are trying to bring it much cheaper than what others are already. Some others are already started doing this, but they are very expensive. We are trying to keep it at rock bottom so that majority of people should be able to afford. And remember, it's only a one-time thing. You don't have to keep on doing a genetic thing.
One time.
Again and again.
Yeah,
Only
one time. Lifetime one time.
Yeah. Because you're knowing your genetic
Yes.
profile. Once you know it, you know your genetic profile.
Then it's okay.
And I guess a little bit also on the scientific evidence that's led to the development of this program.
So the genes which were done in human genome study in 1990 to 2000 actually led to the understanding of preventive healthcare. Let me tell you, this is a tool which we are using to make your diet prescription much more easier, personalized, and what you are able to do it, which adjusts to your routine and to your lifestyle. So the scientific evidence, the genes which are already mapped, the SNPs which are already being tested and being researched are being included in this, and an algorithm, as Dr. Mohan sir has already said, has been created. The AI has been used to tell us that what actually your work genes are suitable to. For example, the caffeine intake. Your body takes efforts to convert this caffeine which you drink through the liver to detox it. So how fast you can convert the caffeine or how fast you can detox the caffeine, it can be explained through this gene report, and the genes which are tested for them definitely are evidence based. Based on that, we'll tell you 2 cups of coffee, 3 cups of coffee. I think this is what you can learn from this evidence based approach of your genetics. You want to add something?
I can give one more example. See, suppose you have an allergy, you're itchy, and you're getting chronic allergy. What do? We'll give one tablet. It will only suppress the symptom. We don't know what you're allergic to. Again and again you're getting allergy. Today we've got allergic testing. So we put a whole kind of patch tests we do, and we'll say you're allergic to brinjal, you're allergic to prawns, you're allergic to this, avoid those foods. That's enough. It's not a genetic test, but it's an allergy test. So with that we're able to do. We don't just give everyone one anti-allergic tablet and say you just take that. We can do that to suppress the symptom. But if it's coming again and again, we have to find out why it's coming. What are you allergic to? It could be house dust. It could be something else, something you wouldn't have thought of at all. It could be medicines. It could be anything. So like that, as science advances, we are able to find the right solutions for the right person. That's it? Okay.
Yeah, that's going to be. I think at the branches. Yeah. So anything at the branches specifically, if anyone wants to ask a question?
Anybody who's come as guests at the branches? Yeah. Tambaram? Yeah.
Yes.
Please ask. Unmute and you can ask.
Please go ahead.
Please ask your question.
Check your speaker, please, sir. We can't hear you. Your mic.
Doesn't say muted.
No, they're unmuted. No, we can't. Maybe you could type in the question, sir, if you don't mind.
Can you type the question, please? Because we're not able to hear you.
There's something wrong with the mic there. People outside can hear, we can't hear.
Phone the can you?
Meanwhile, other branches.
Any other question?
Ask him to raise a virtual hand.
You can see Dr. Gupta. The Gupta, you can ask the question to Sundar, and then we can reply.
Keep it at the mic.
Okay, you can.
Go ahead, sir.
You can say now. We kept it near the mic.
Sir.
Yeah. Yes, Gupta. Go ahead.
Yes, sir. Mr. Srinivasan is asking whether how it is going to help the younger generation to prevent the lifestyle disorders in the children.
By younger generation, I don't know what age you mean. I think it's a younger generation today which is affected with diabetes, blood pressure, obesity. It's people in their teenagers, 20, 30. These are the people who are getting all these problems. And at that age itself, if you're able to find out what is good for your body, then for many, many years, what's the point of finding it out when you're 90 years old, when your life is already fully lived? At that time, finding out, oh, I should have done this 30 years ago. That doesn't help you. But I think for the youngsters, doing it early actually makes more sense because they've got so many years to live.
So also can GLC guide with specific drugs? Dr. Anjana again, can GLC guide us with specific drugs?
We are coming to that. So we are starting with lifestyle, but definitely yes, fine, because I think Dr. Geeta also showed certain genes which are associated, because we know, right, let me give you an example. You give metformin to somebody. Some people can take 2 grams, 3 grams of metformin, no side effects, no diarrhea, nothing. Another person you give metformin, 250 milligrams, they'll have so much of diarrhea they have to stop. Why? There is a genetic difference, obviously. Statin, given for cholesterol. You give statin to somebody, they have no side effect, they can take bigger dose, their cholesterol can come down very well. Another person, they take statin, they'll develop muscle pain, such severe muscle pain they have to stop. We know that for all these genes have been now identified. It's already there in the literature. So if we, I told you about clopidogrel. So by finding that out, we can say yes, not only this can, once you have a genetic profile, you can use it for anything. Why only for diet, only for exercise? You can use for medicine also. Whether you respond to GLPs or you respond to DPP4 inhibitor or your metformin is best for you. All this we can find out using a genetic test. As we start using, nobody is using it in the world today. We are the first to do it. So as we do it, once we learn 1,000 cases, 2,000 cases, we will understand about it and then we will be able to further improve our technique as we have done in everything else in the past.
Two people have the same question, so.
Oh, you're right.
Nizamabad had your hand up.
Maybe one more. Nizamabad.
Can you unmute that, please?
Ask them to raise a virtual hand if they have a question.
Anyone who has a question, please raise your virtual hand.
Manudeep is asking something.
Manadeep,
So
go ahead.
Just put it there.
Okay, I'm going ahead with this question till you unmute that. So Manodeep has, they have a patient there, Mr. Raj Agarwal. He's liking the concept and questions whether the counseling will help him modify his current treatment. He's on insulin and other medications.
Maybe, because once we find the right diet, we'll probably be able to help him regarding his medicines as well. So yes, it will help the treatment as well. Dr. Manadeep is from Siliguri, so right from Siliguri there are some questions.
When is GLC coming to the rural areas?
Whole India can use it. Why urban,
Yeah,
rural?
it's digital, so it can go
Yeah, it
right
can go
now
anywhere.
everywhere.
Why only in urban? That's nothing like that. Anybody logs in from anywhere, they can do it.
If Amazon parcel is reaching your house, we will also be there.
And there is no storage of no cool thing and all needed. No, can be sent since saliva can be sent. So there's no dry ice or anything. So there's no.
There are demand for your center in Mumbai. 3-4 people have asked. So.
We start with GLC there and Pune. Okay.
I think.
Thank you. So I'd like to thank all of you. Please bless this project. Please give it wide publicity. Let more and more people benefit. Thank you very much for coming.
Thank you. We request everyone to stand for the national anthem and then please join us for IT after this. Thank you very much. Please join us for the next.
4:50 கரெக்டாக முடிஞ்சுது. 4:30 முடிஞ்சுது. அவர் வண்டியில் வச்சுட்டு வந்து அதை தேடிக்கிட்டு இருந்தாங்க. அவர் இல்லை, அவங்க இவர் பக்கத்தில் நின்று ஃபுட்டு எல்லாமே. நான் வெயிட் பண்ணல, அந்த வாட்டுக்கு சொன்னாங்க பக்கத்தில் தான் அந்த ரோடு தானே உட்கார்ந்தேன். நான் உட்காந்து அங்கே தான்
Genomic Lifestyle Counselling. அது என்னன்றது ரொம்ப சுலபமாக சொல்கிறேன். அதாவது இப்போ ஒரு டயட் ப்ரிஸ்கிரைப் பண்ணுறோன்னா ஆகார கட்டுப்படுத்தல் சொல்லி கொடுக்கும்போது யூஸ்வலாக ஒரு டயட் எல்லாருக்கும் கொடுத்துட்டு இது சாப்பிடும்போது வெயிட் குறைஞ்சிடும், சுகர் குறைஞ்சிடும்னு சொல்லி கொடுப்போம். பாதி பேருக்கு அது ஒர்க் பண்ணுறதில்ல, சூட் ஆகாது, சிலவங்களுக்கு அலர்ஜி இருக்கும். இப்போ தக்காளி சாப்பிடணும்னு சொல்லுவாங்க, தக்காளி சாப்பிட்டா எனக்கு ரீனல் ஸ்டோன், கிட்னி ஸ்டோன் வந்துருன்னு சொல்லுவாங்க. அந்த மாதிரி பல கண்டிஷன்ஸ் இருக்குது. இப்போ ஒன் சைஸ் ஃபிட்ஸ் ஆல் மாதிரி தான் இப்போ எல்லாருக்கும் ட்ரீட்மெண்ட் கொடுத்துருக்கோம். எல்லாரும் டயட் எடுத்துருக்கோம், எல்லாரும் நடந்துருக்கோம், அந்த மாதிரி தான் சொல்கிறோம். ஆனால் சிலவங்களுக்கு ஒர்க் பண்ணுவோம், சிலவங்களுக்கு ஒர்க் பண்ணாது. இப்போ புதுசாக என்ன கண்டுபிடிச்சிருக்கோம்னா உங்கள் அணுக்கள், ஜீன்ஸ், பாடியில் இருக்கிற பிளட்டில் இருக்கிற ஜீன்ஸ், ஜெனட்டிக் மேக்கப் தான் உங்கள் ட்ரீட்மெண்ட்டை வந்து அது வலிக்குதா இல்லையா, ஒர்க் பண்ணுதா இல்லையான்றதை டிசைட் பண்ணுது. ஸோ அதுக்காக தான் இப்போ வந்து இந்த ஜெனட்டிக் டெஸ்டிங் மூலமாக ஜிஎல்சி, ஜெனட்டிக் கவுன்சிலிங் வந்து பண்ண போகிறோம். அதாவது ஒரு சின்ன எச்சில் இருக்குல்ல, சலைவா, அது எடுத்துட்டா போதும், அதுலேருந்து ஒரு ஜெனட்டிக் மேக்கப் என்னன்றது தெரியும். அது பிரகாரம் உங்களுக்கு ஆகார கட்டுப்படுத்தல், எக்ஸசைஸு, எத்தனை மணி நேரம் தூங்கணும், எந்த மருந்து கொடுத்தா உங்களுக்கு சுகர் நல்லா கண்ட்ரோல் ஆகும், இந்த பர்டிகுலர் குரூப் ஆஃப் மருந்து வேலை செய்யுமா வேலை செய்யாதா, அதெல்லாம் இப்போ கண்டுபிடிக்கிற மெத்தட் வந்துருக்குது. அது வந்து இந்த ஜெனட்டிக் அனாலிசிஸ் இப்போ ஏஎல்லாம் கூட வந்துருக்குது. எங்கள் லார்ஜ் டேட்டா பேஸ் வேறு இருக்குது எங்களுக்கு. அதனால் இந்த ப்ரோக்ராம் வந்து நாங்கள் ஆல் ஓவர் த கண்ட்ரி நாங்கள் அதை எஸ்டாப்ளிஷ் பண்ணுறோம். அது இங்கே வரணும், சென்ட்ரலில் வரணும்னு அவசியம் இல்லை, ஆன்லைன் கூட பண்ணிக்கலாம். அதை பற்றி சொல்கிறதுக்கு டாக்டர் அஞ்சனா
இந்த ஜிஎல்சின்றது வந்து கம்ப்ளீட்லி டிஜிட்டல் ஆன்லைன் ப்ரோக்ராம். இப்போ என்ன பண்ணணும் அப்படின்னு கேட்டிங்கன்னா, நீங்கள் அதில் ஃபர்ஸ்ட்டு ரெஜிஸ்டர் பண்ணணும். ரெஜிஸ்டர் பண்ணிட்டா ஒரு கிட்டு அனுப்புவாங்க, அது அமேசான் டெலிவரியில் வீட்டுக்கு வரும். அந்த கிட்டில் என்ன இருக்குன்னா, நம்ம வந்து கோவிட்லலாம் அந்த ஸ்வாப் ஒன்று எடுப்பாங்க தெரியுமா, வாயிலேருந்து, அந்த மாதிரி ஒரு ஸ்வாப், அது நாமளே எடுத்து அந்த கிட்டுக்குள்ளே போட்டு திருப்பி அனுப்பணும். அது லேபுக்கு வரும். லேப்லேருந்து 3 வாரம் ஆகும் அந்த ரிப்போர்ட் வர. ரிப்போர்ட் வந்துருச்சுன்னா அது க்ளீனாக தெரியும் உங்களுக்கு வந்து எந்த சாப்பாடு வந்து ஒத்துக்கும், உங்களுக்கு வந்து ஏதாவது டெஃபிஷியன்சி இருக்கா, உங்களுக்கு வந்து எந்த டைப் ஆஃப் உடற்பயிற்சி பெஸ்ட்டு, எந்த டைமில் தூங்கினா உங்களுக்கு அது ஹெல்த்துக்கு பெஸ்ட், இந்த மாதிரி நிறைய திங்ஸ் அதுலேருந்து கண்டுபிடிக்கலாம். அதுலேருந்து நீங்கள் உங்கள் ஹெல்த்தை இம்ப்ரூவ் பண்ணிக்கலாம். இப்போ வெயிட் லாஸ் ஆகணும்னா அதுக்காண்டி பண்ணலாம், இல்லை சுகரை கண்ட்ரோல் பண்ணணுமா, பிபியை கண்ட்ரோல் பண்ணணுமா, இது எல்லாமே பாசிபிள் இந்த ஜிஎல்சியோட.